The knee joint is the largest joint in the human body. It contains various ligaments that hold it together, 6 of them of which we're concerned with. There are 2 cruciates, 2 collateral ligaments, and 2 coronary ligaments. The cruciates are deep inside, the collaterals are on the outside, both the inside and the outside, and the coronary ligaments are in the front, slightly to the side also, and on the other side holding the meniscus in place. The joint contains the cruciate ligaments, way inside, various bursars, and the menisci, which cushion the femur on the tibia. There are many bursars in the knee. The function of the bursar is to cushion movement of the tendons, the ligaments, and the muscles so that they slide without rubbing against bones or each other. There are several important bursars that we're concerned with. One is the prepatellar bursar, which is right on top of the kneecap, the infrapatellar bursa, which is underneath the tendon below the patella, and the suprapatellar bursa, which is underneath the quadriceps muscle here that allows it to slide without irritating itself by rubbing on the bone. The cruciate ligaments are deep inside the knee joint, right in the middle. They occupy a space called the intercondylar notch. Here is the anterior cruciate ligament from in front, and the posterior cruciate ligament as seen from the back. The posterior cruciate ligament goes from the front of the femur to here on the back of the tibia. The anterior cruciate ligament goes from the front of the tibia to here on the back of the femur, on the inner aspect of the lateral condyle. There's a crisscrossing arrangement, like an X, that goes from front to back, and this offers your body stability, so that when you're walking or moving, your leg doesn't fly forward or backward. The anterior and posterior cruciate ligaments control that motion. The posterior ligament controls and limits the backward motion, and the anterior cruciate ligament stabilizes the forward motion. By preventing backward and forward movement, the cruciate ligaments ensure that the condyles of the femur stay in one place as they roll on the condyles of the tibia. When these ligaments are lax, the knee becomes very unstable and wobbles around, and many injuries follow. Between the femoral condyle and the tibial condyle is a half-moon-shaped piece of cartilage that we call the meniscus. This is a very important cushioning device that helps the knee stay healthy. Here are the 2 articular surfaces of the tibia. The 2 menisci sit on top of them. They're made of a flexible fibrocartilage. They're shaped a little differently from each other. The lateral one is almost a circle. The medial one is more C-shaped. Each meniscus is thick at the outer edge and thin at the inner edge. The menisci move forward and backward with movement. They cushion the movement of one bone on another. If you look at the tibia here, this is a pretty flat surface. If you look at the femur, this is a very round surface. So when they impact one another, if the menisci weren't there, you'd have a lot of trouble. You'd erode the bone away. So you have this little receiving cup that receives this pointed femur and creates a little place for it to rest and spread the load around. When this menisci tears, it will separate and turn over on itself, and that's when the knee gets stuck, usually in flexion, and you can't straighten it because it's crushing this menisci in various configurations and causes tremendous pain. Chondromalacia, also known as patellofemoral arthritis, means that there's an erosion of the articular cartilage underneath the patella as it articulates with the surface of the femur. This irritation causes tremendous pain. Now, some people have a lot of grinding and crackling, but no pain, and others have. Why not? Well, it has to do with the thickness of the articular cartilage. Articular cartilage is like a Teflon coating over the bone. So the patella is rubbing in this groove. And if the cartilage rubs away and isn't there anymore, you've got bone rubbing on bone. So both surfaces erode. Some people have an 1/8 of an inch thick, some people have a 32nd of an inch thick coating on their bone. So when it rubs away, either by accident and cracking or just by erosion over time, that's when the pain starts and the swelling starts. If the person has a lot of articular cartilage, you could have sound but no pain.